Sistem penjagaan kesihatan di Malaysia adalah antara yang terbaik di dunia. Namun mengapakah wujudnya perbezaan antara mereka yang mendapat akses kepada sistem penjagaan kesihatan kerajaan dan juga sistem penjagaan kesihatan dan juga perkhidmatan penjagaan kesihatan swasta? Dan bagaimanakah jurang ini boleh dikecilkan lagi untuk memastikan bahawa penjagaan kesihatan berkualiti dapat diakses oleh semua pihak di dalam Malaysia? Kita bersama dengan Nadia Wan, Ketua Pegawai Eksekutif Thomson Hospital Kota Damansara untuk melihat kepada bagaimana ini boleh menjadi salah satu polisi kerajaan bergerak ke hadapan. Ini Rizal Zulkafli dan juga ini adalah perbincangan yang kami lakukan selepas Khazanah Mega Trends Forum 2018 dalam AWANI Global. So, Nadia, we're discussing balance and the issue of balance in the private healthcare sector or in the healthcare sector in Malaysia. Currently, we're seeing huge expansion by the private healthcare providers in terms of beds and number of hospitals all around the country. At the same time, we see limited access by the people who have no health insurance to the private healthcare system and the quality that it has and it can provide to these patients. How do we strike a balance between expanding and also making sure that the rest of the population can also enjoy the same quality of healthcare that these private healthcare providers can provide?
I think there are a couple of issues when we talk about access. One is obviously the capacity. So as you rightly said, the private healthcare providers are actually expanding in terms of capacity in providing service, and this is actually helping to offload a lot of the pressure from the public health system as well. So I think that's good, but I think it's important for us to remember that when we talk about healthcare, it's more than hospitals. So I think at the primary care level, which is the most important part, they are the gatekeepers, they are out in the community, and without them, if people only come to the hospitals when it's too late, that's when the cost escalates. So a lot of primary care is also provided by private practitioners, GP clinics in the market, and so they also play a very important role. And if we talk about access, I think insurance is something that we can't avoid in terms of how people are going to pay for care, and there have been discussions from the government about introducing at least medical insurance, subsidized care for the B40, which is some new development that will change the healthcare landscape in Malaysia. In the past, I think we had two separately running systems where we had a private care system with private insurance and you had a public system that was fully subsidized and it was free. But I think the problem with that system is obviously cost-wise, it's not sustainable. And secondly, people don't really feel accountable for their health. So again, coming back to your question about, you know, where is that balance? I think it's increasingly looking as if we have to work together with the public sector. There is still need for public investment, not just in providing care, but also investing in research, new technologies. We have university hospitals that are part of the universities where they are looking at research into new protocols, new technology, and obviously that is something where public investment is really required because it's very difficult to get the private sector to really invest in research and education. So that part is still important. But I think, yeah, there's more room for public-private partnership. We have been working in the past very closely with the Ministry of Health and the public sector players. But in the future, I think the collaboration needs to also move beyond providers and start looking at the financial institutions in terms of providing insurance. Perhaps we can see the growth of new organizations that, like in the US, where you have hospital groups that have an insurance for the patients and they provide the care as well, and having it in a much sort of like integrated ecosystem. So there are a lot of new models that we can play with, and hopefully the regulators can also keep up because that is also an important part of the puzzle.
Currently, what are some of the pain areas in the healthcare system in Malaysia? We know access, we know capacity. These are some of the pain areas, but what are some of the pain areas when it comes to providing the best technology to the general population?
Well, definitely, of course, the cost of some of these equipment and systems, because they are mostly developed in the developed countries. And of course, when we need to import these systems in, then the cost becomes really substantial for the average Malaysian. And of course, the most important important thing when we talk about healthcare is the talent gap that we have. It is not really at the level of general practitioners, but it's more on the subspecialties, you know, because medicine is really evolving to be very hyper-personalized. So in the past, you may have an orthopedic surgeon. Now you have, for the same specialty, many subspecialties like foot and ankle surgeon, spine surgeon, hand and microsurgery surgeon. So all these subspecializations obviously give you better quality care, but it also comes at a higher cost because everything is becoming more specialized. So you need specialized equipment, specialized nurses to assist these doctors. So there's the pros and cons of it as well.
And you talked about the hyper-human connectivity between the personnel and also the patient. What are some of the challenges right now, especially when people talk about IR 4.0? These are the buzzwords right now.
Yes.
IR 4.0, you know, human interaction, digital economy. But on the other hand, there's still a very human-centric economy of a service system that you're working with. What are some of the challenges to managing that and ensuring that, yes, we also move forward with IR 4.0, but let's not forget about a human-centric approach to these services?
So I think there are very much two opposing forces when it comes to it. I mean, if we look at basically medical education that the doctors are going through now, I think, like, you know, perhaps the kind of treatments that they have provided have changed, but the way in which doctors are being trained has not changed in hundreds of years. And so how are they going to cope with all these new technologies now? We're talking seriously about artificial intelligence in terms of pattern recognition, and eventually doctors such as radiologists or pathologists may be put out of job because computers can assess patterns better. But at the same time, of course, we as humans feel that when we are ill, we want to see another human. Do we really want to see a robot actually coming and diagnosing? But there's a lot of back-end things and B2B things in healthcare industry that we have been slow to exploit, I think, the IR 4.0, both because as an industry we are naturally risk-averse, because the consequences of making a mistake can be quite severe, but also because I think you know, there are these questions about ethics and things like that. For example, I mean, we know that we can edit the genome now to, you know, create whatever babies that we want. I mean, for us, we are a big provider of IVF and reproductive health services. But, you know, these are ethical questions that we need to sit down as humans and as a society to actually decide what are the kind of technologies that we are willing to adopt, which will result in better outcomes. But there's also that ethical part of it that also needs to be part of the conversation as well.
You mentioned the phrase risk-averse. Does this mean that the industry is moving within a very tight constraint, moving forward in that very tight constraint?
Yes, because I think
it's very difficult for you to move forward.
Well, I mean, rightly, of course, it's a very tightly regulated industry. So as you know, healthcare in Malaysia, doctors' fees are regulated. Hospitals are very closely regulated. You know, you have to have a license from the Ministry of Health before you even build a hospital, and they regulate things like your staffing ratio, the kind of procedures that you have in place. So when you want to introduce something new, it does take everyone to sort of come in and say that this is where we want to go and we will support it. And I think the DG in particular and the Ministry of Health has been actually very supportive of things like telemedicine and all these. But again, the legal infrastructure, because you're talking also about medical legal regulatory frameworks, and there's a lot of things that go beyond the Ministry of Health. I mean, the Ministry of Education, if you talk about university hospitals, they actually come under the purview of the Ministry of Education, not the Ministry of Health, but they're producing the doctors. You know, you have the Ministry of Environment, you talk about water quality, air quality. These are obviously very direct impact on health. Telecommunications, when we talk about the infrastructure, broadband to actually, you know, provide all these services such as cloud computing and whatnot. In cybersecurity, we had a very big hack in Singapore involving personal data, and obviously in healthcare that data is very sensitive. And you know, so while we want to be at the forefront, there are a lot of things that we have to seriously consider, because again, the consequences of getting it wrong is quite severe.
You mentioned ecosystem. One of the ecosystem is to also ensure that doctors and the medical professionals are well paid. to be able to serve in this country. I've heard that a lot of doctors are moving to Singapore because they've got better pay, they can get better pay over there.
I don't think that the pay of doctors here, especially in the private sector, if you're talking about specialists, is they're definitely in the 1% of the
but
population.
In the public sector, is that
yes, but
still an issue?
So they are moving from the public sector to the private sector, definitely. But I think there are many other factors why people are leaving aside from money. You know, definitely socioeconomic, you know, when they talk about family and all that. And also because the frustrations that they have within the ministry. I think it's also a very sad, vicious cycle that you have where if doctors are leaving and you're the sole doctor running the unit, the burden becomes yours. But because the ministry is so big and they haven't come up with a solution how to provide help for this person, eventually this person also leaves. So it's a bit of a vicious cycle, and I believe the ministry is really looking into the operations of the service delivery in the public sector. But I just also would like to caution that in addition to providing the services, they also need to think about how they serve as policymakers in terms of catalyzing the growth of the healthcare industry, which the previous administration had identified as a growth driver for the country. So you see a lot of medical tourism initiatives being put in place. But at the same time, it is not just about hospitals, I think, healthcare. People need to remember that. I mean, you have medical equipment and devices, you have medical health systems, you have, you know, all sorts of things where these are sort of adjacent industries that we could look into catalyzing and becoming future drivers of growth for the country.
Who are these medical services providers and equipment providers serving? Are they serving the private healthcare institutions with more money, or are they looking at also providing the same access to the public healthcare environment?
The public hospitals are actually really good. I mean, they had electronic medical records 10 years ago before any private hospital had them. And you know, they were funded by the government. They had good money invested in equipment and labs because they also have the scale. But how has that translated, you know, as when they procured these services, how did that translate into a catalyst to create growth of companies who are providing these products and services to a larger market, not just Malaysia, obviously, because, you know, if you talk about Indonesia, you talk about Vietnam, all these countries are hungry for an alternative to the Siemens and GEs of the world that are producing and selling the bulk of medical equipment in the world right now. And China has realized that and has come up with a lot of innovative technology. I mean, they're not difficult. You know, CTs and MRIs are fundamentally not changed in the last few years, but they're doing it at a very attractive cost. You know, for me, to buy a new CT scan could easily cost 7 million if I'm buying a Siemens one. And China could do it for like, you know, a tenth of the cost. And so, you know, so you're seeing real competition coming out of China, and I feel that because Malaysia had a good healthcare system, we could have had a good sort of like experimental or sort of guinea pig to actually test out all this, because we have the good delivery system, we can track the outcomes, so we could do a little bit more to actually develop the healthcare industry outside of just building hospitals. I know IHH has been a very good success story, you know, a very big healthcare service provider, but again, it's still focused on hospitals. And I feel that the story is much larger than that. If you look at the future of healthcare, a lot of it is about prevention. Traditional Chinese medicine has become very professionalized in a way in China, and how we as Malaysia can actually take advantage of our natural and historical connections to all these things to actually really move forward in the area and become the beacon for the region, Southeast Asia, Asia Pacific.
I want to zoom into what you said just now, which is the fact that you acknowledge that the public healthcare system is a good system.
It is a good system.
There is a lot of myth and a belief out there that if I go to a public hospital, I would probably be not as well taken care of as opposed to if I go to a private hospital. The doctors are not of good quality, the nurses are not good quality. Is this a myth that is still going around out there? And why is there a myth of that nature going around out there?
Well, I don't know, but I think that, of course, if you go to a public system, and this is true in Malaysia or in the UK, you have to wait because there is an access and capacity block. But the people who are trained in the public system are good. I mean, the system has been put in place for many years. It's just that the perception that you may get is because a public system is the training ground. There are no private training hospitals yet in Malaysia because of various regulatory issues that need to be sorted out. So you will likelihood, chances are, if you're not a complicated case, being handled by a registrar, someone who's not a fully qualified consultant, and therefore people may feel that they're not getting as good a care. But if we look at the outcomes in the public sector, I think they're still relatively good. I mean, I think 2 days ago, Malaysia was awarded or acknowledged as the 12th country in the world to stop mother-to-child transmission of HIV and STD. So, you know, they've done really major accomplishments, and I think people don't give them enough credit for that. But of course, on a day-to-day basis, when you're sitting for a long time waiting, and you have nurses who are tired and maybe not smiling. So these are some of the things that perhaps are the customer service part of it that people relate to. They may feel that they're not getting as good enough service.
Are you working together with the policymakers to also address some of these quick wins and some of these issues that can maybe solve in the very near future?
Well, I think, you know, we have been engaging with the administration, of course, and with this change now, I think some of these plans need a bit of re-looking into. But the ministry has announced several initiatives that will impact the private sector. The B40 insurance is one, drug price controls will be another, and we have the Association of Private Hospitals that's taking up this engagement with the ministry. But we do hope to see a little bit more focus on the private sector, because it may be a little bit skewed to the public sector now. Perhaps they feel that there's a lot of things that need cleaning up or things that need to be revamped. But it's important to remember that the private sector is also contributing to the healthcare GDP, and it's important to remember that it's not just hospitals, I think.
But these are different concerns from the private sectors, from the private sector healthcare providers.
Sorry,
These are different concerns. These are not the same concerns as the public sector healthcare providers. Are they the same concern that the government should also address in the private sector?
Well, I think the concern is that a lot of policies may be developed without sufficient engagement from the private sector. I think that is like the key concern right now, because you know, if you have come up with the policies, have they had enough time to engage and really understand? Because they are the new government coming in, having never actually worked in the Ministry of Health before. Do they really understand where we're coming from? So I think that is the key concern that a lot of the private sector players, but I think they're doing a lot of things to address that. They have the advisory council and all of that, but the tendency is always to choose the biggest in the industry to sort of represent. And some of the smaller players, for example, GPs in the country, they are mostly independent, so they have their own different federations or the MMA council. Whether or not that represents sufficiently diverse views for the ministry to take into consideration is another thing.
You are a young CEO.
Yeah.
I'm going to be very ageist about this.
Yes.
You're probably going to be.
I can't avoid this
ageist.
question wherever I go.
I know. But what fresh perspective do you bring into the organisation as a young person, and what do you hope young people out there would also bring into an organisation when they come in a leading position, in a position where they can make changes and policies?
Well, I think like being young, obviously there is a lot of pressure to see, like, you know, what can you do that you know, other people who are older than you who probably know better can't. But I think the new perspective is that I feel that young people have a larger stake in the future. You know, when I look and think about planning, I'm thinking about 20, 30 years from now, because I will still be alive. And that is a subconscious perspective that perhaps some of the older people may not have, because I'm only going to work for another 10 years. Do I really care? I mean, they may say that they care for the future, but is that really something that they live for? So I'm very concerned about continuity, about whether we have sufficient processes that will allow the organization to actually survive 50 years from now, because I will still be there and I want to make sure that the legacy is there. So a lot of my work and focus right now is trying to create an organization that, one, has sufficient governance and processes that will allow it to survive the turbulent times that are coming, because the pace of acceleration is also changing. And two, because I feel I have a responsibility to other young people to actually develop them. I've been very lucky to get a lot of opportunities at an early age, and so what am I doing to give back, both to women and both to young people? By the way, I think younger people get more discrimination than women get discrimination from men, because, you know, an older female leader could be equally condescending. So then the thing is, what do we do to actually expose them? Because I believe that, you know, talent comes in very many forms. It could be different ages, people have different skills, and how do you bring those skill sets together? I mean, having past experience is very good, but we also need people who can look forward to the future. And I'm a big fan of Nassim Nicholas Taleb and his book on Black Swan. And really, you know, a lot of times when you talk to people in healthcare, you know, you tell them about AI and what it means for doctors, what it means that we may not be paying doctors as much as we are paying them now, and is society okay with that? You know, all those implications, and the first reaction you generally find is that, oh, you know, this is healthcare, like you can never replace a doctor. Well, I don't know, now you go around, you sit
Do you
and
find
rest.
yourself having to defend your age over and over again continuously?
Yeah, and sometimes, you know, when I first started, like I said, Facebook, and I said the hospital needs to have a Facebook page. And obviously it's terrible because if you go to any hospital Facebook pages, it's always about complaints because people tend to want to write complaints more than they want to write compliments.
You listen to
right?
the complaints that you find
I
on your
do,
Facebook
I do.
page?
I get all the emails on the complaints and
Okay.
compliments that we receive in the hospital. But, you know, and the instinctive reaction for a lot of the older leaders was, why even expose ourselves? Just shut it down, don't have anything. But to me, transparency and being able to directly access the consumer is very important, because I think that in this age, you know, news travels really fast. And if you shut down that channel of communication with your own customer, with your employees, then you're putting yourself at a disadvantage. So that's some of the key principles that I have when I'm leading the organization, is the access to customer feedback and also access to employees as well. So we have town halls, we have Slido so that people ask whatever questions they want without feeling that they have to filter it through the senior management. So I think transparency and accountability with that is very important moving forward, because trust is an issue. It's not just trust between the consumer and the organization, it's also trust between the employee and the employer.
The theme for Khazanah Mega Trends Forum is balance. What kind of balance do you bring into the organization? What do you introduce? What balance do you introduce into the organization so that people have better quality of life when they work in healthcare?
So, you know, if you talk to different CEOs, they either focus on, my focus is on the customer or my focus is on the employee. And I won't say that either answer is wrong or right. But for me in healthcare, it's very important to put the employees first. I'm not saying that customers aren't important, but because the majority component of care is the caregiver. If the caregiver doesn't feel happy, doesn't feel motivated, and because the kind of problems that you come in healthcare, they're not standardized problems. You know, you could come up with a crisis here and there. And so teamwork between the caregivers is very important. So I tend to focus on that. So making the workplace safe, you know, letting the staff feel that they're more engaged, that they're able to escalate issues. I think we can definitely take lessons from the airline industry, where safety is also a concern for us. But if people don't feel like there's a safe space to raise issues and they get swept under the carpet, then it's just a disaster waiting to happen. So these are some of the things that I'm focusing on and bringing that to the organization.
Well, my last question is for those out there who have their mind, when they look at healthcare, they think of programs and series on TVs like Grey's Anatomy, Scrub, like ER.
Okay.
Is it as fun and exciting as that when you know, go into the hospitals, when you observe people working? Is it as fun as that? Is it exciting?
Yeah, I mean, well, I chose healthcare, so obviously I think it's fun. And the fun comes from the complexity, and because we're dealing with people. And, you know, people are funny and they come in every day, and you just never know what kind of issues that you're going to have, you know. So you have different patients coming in, different doctors, so the sort of problems that you face. It's a human drama. It is. I think the shows get that right. It's a human drama, and that's really the interesting part about healthcare.
Thank you very much, Nadia.
Thank you.
Thank you. Jadi bergerak ke hadapan, tentunya akses kepada penjagaan kesihatan yang berkualiti adalah salah satu cara untuk mengukur kesejahteraan rakyat, melihat kepada bagaimana Malaysia akan menjadi sebuah negara yang semakin berumur bergerak ke hadapan. Jadi apakah yang akan membezakan negara kita dan juga negara-negara lain di rantau Asia dan juga menjadikan negara kita lebih kompetitif dalam menjaga kesejahteraan rakyatnya? Riza Zulkifli, AWANI Global.